Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here is Nikki Hawkins.
While October is Breast Cancer Awareness Month, it's important to think about breast health all throughout the year. Approximately 1 in 8 women in the U.S. will develop invasive breast cancer at some point in their lives. While advances in screening and treatment have reduced the overall risk of death from the disease, the number of people diagnosed with breast cancer continues to rise. Breast cancer is most successfully treated when it's caught early, and there are things we can do to reduce our chance of developing breast cancer. So today, we are happy to be joined by Dr. Elissa Dalton, breast surgeon at Mainline Health, and we will take a look at the risk factors for breast cancer and what we can do to prevent it. Welcome, Dr. Dalton.
Thanks, Nikki, and thanks for having me here today to discuss this really important topic.
Indeed. First question, Dr. Dalton, what kinds of things make women or men more likely to develop breast cancer?
So there's basically 2 categories of risk factors for breast cancer, things that we can change and things that we can't change. Things that we can't change include your age, being female, a family history of breast cancer, a known genetic mutation that increases your risk for breast cancer. And then there are things that we can change, such as maintaining a healthy weight, eating a healthy diet, regular exercise, avoiding tobacco and alcohol.
So if you have risk factors for breast cancer, what should you do?
So you should talk to your doctor about assessing your risk and potentially genetic counseling if that's indicated. You should talk with your doctor on a regular basis about having mammograms, and sometimes if you are at increased risk for breast cancer, you can also consider supplemental screening for breast cancer, things like breast MRIs.
So when should you start having mammograms? I think there's, some confusion around that, so some guidance would be appreciated.
Sure. So we recommend annual screening mammograms for women over the age of 40, beginning at the age of 40. Sometimes that number is actually lower if you talk with your clinician and find out that you're actually at significantly increased risk for breast cancer because you have a genetic mutation. So pretty much the only time that we start screening for breast cancer early is in the setting of a genetic mutation.
And what does family history have to do with diagnosing or risk factors when it comes to breast cancer?
So that's a great question. Family history contributes to your personal risk for breast cancer, but it also could indicate that you would meet criteria for genetic counseling and possibly genetic testing. And if genetic testing does identify a genetic mutation that increases your risk for breast cancer, there are certain steps you can take to decrease that risk significantly. Those steps include sometimes even prophylactic surgery, sometimes medication that can decrease your risk for breast cancer, and certainly you would then meet criteria for intensive screening with alternating mammograms and breast MRIs every year.
Great. So what should you do if you're worried about having a breast cancer gene?
So you should talk with your doctor about if you meet criteria for having genetic testing. You can also discuss directly with a genetic counselor, and they would be the ones to consider genetic testing for you. There are multiple different breast cancer genes, not just the BRCA gene, which a lot of people already know about. There's actually quite a number of other genetic mutations that can increase your risk for breast cancer at varying levels of increased risk.
So tell us, Dr. Dalton, what else can we do to lower our risk for breast cancer or help with early detection?
So I think knowledge is power. Knowing your own history, knowing if you do in fact have increased risks for breast cancer, and then those modifiable risk factors that we talked about, just taking small steps at a time, trying to change your diet on a daily basis, taking a walk at lunchtime. Those little tiny things tend to add up over time. And just because you have increased risk for breast cancer doesn't necessarily mean that you will develop a breast cancer over your lifetime. But knowing that you're at increased risk can help you to change those things.
Excellent. So all great information. Thank you so much for joining us today, Dr. Dalton.
Thank you so much for having me here.
All right. To learn more, visit mainlinehealth.org/wellaheadphilly.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.